Welcome to another episode of Africa and Europe Insight by the Sunny Ofehe Show on Ben Television. In this episode, we take a look at a non-for-profit organization in the Netherlands called Pameijer and the social work it carries out on the physically and psychologically challenged people, with special attention on reintegrating them back to society. This episode will look into how this model can be replicated in Nigeria and used by the government or the private institution to take out people with special needs that roam streets in major cities in Nigeria. These people have become destitute, whereas a proper program such as that by Pameijer can give these people better life and make them useful to our society in Nigeria. Nigeria is the most populous black nation in the world, with a population of approximately 180 million people spread across 250 ethnic groups, speaking almost 500 languages. The rebasing of the Nigerian economy has put the country as the largest economy in Africa. Nigeria is the 8th largest exporter of crude oil in the world and a member of OPEC, Africa's largest oil-producing country. Despite huge revenue from crude oil, 70% of the population still live under $1 per day, a World Bank definition of poverty. Corruption and misappropriation of funds have led to collapse of the institutions that should breathe life into major economic sectors such as education and healthcare services. The Netherlands is a densely populated country in Europe with a population of 17 million people. I have lived here now for almost 20 years, and my personal experience have shown that the country has the best social and health system in the world. Every citizen has a compulsory access to Medicare under the Affordable Health Insurance Scheme that is subsidized by the government for those with low income. The government is also funding organizations that have the special skill and knowledge to render services to the ordinary people who face health challenges or displaced from normal life, either because of economic or social problems. Today, many people who would have become liabilities to the state have been engaged in these social services and now have jobs, homes, and even return back to studies. Pameijer was founded in 1926 by a medical doctor, Mr. J.H. Pameijer. This organization covers the southern part of the Netherlands with its headquarters in Rotterdam. In order to understand the structure and functionality of the organization, I sat down with a staff of Pameijer to understand the reason for their success story, and he has this to say.
Pameijer is one foundation with about 2,200 employees, and we support and treat about 4,800 people. Now we are partly funded by the city councils, and we are partly funded by regional organizations of communities, and partly by the healthcare assurance.
So how do you source for your clients?
Very different. It can be the local doctors, it can be the city council. We have in every quarter of the city, we have teams. Look at the people in the neighborhood, and when they find something or people in need, they refer to us, and then we come in action.
So which means your clients are actually people with medical conditions?
Partly, we have a lot of clients with learning disabilities, and we have clients with psychiatric problems.
What about people who are either involved in usage of drugs? And
yes.
Okay.
Partly that's people with psychiatric problems and addiction or behavioral problems.
So if I understand you very well, which means these clients are usually referred to you by either the insurance company, the medical doctors?
The medical professionals,
Yes.
The general practitioner, specialists. It can be that a psychiatric hospital says to a client, the treatment is over, so now Pameijer, can you support this person to pick up his life again, try to get a job, housing, etc.
Goeiedag.
Goeiedag, kan ik u helpen?
Ja, heel graag. Ik vroeg me af, waar ben ik hier terechtgekomen?
De bibliotheek, de apotheek, gezondheidscentrum. Dit is een gezondheidscentrum. Wij kwamen allemaal van Pameijer. Werken we hier met z'n allen voor het bedrijf, voor het gezondheidscentrum. En dan doen we opdrachten voor. Mijn collega kan een rondleiding geven.
Nou, heel graag.
So who are the people that can work for Pameijer and be able to take care of? Do you have like a team of medical doctors as well? Because you're talking about people who...
We have a few psychiatrists, but that's a small number. Most of the organization are professionals who support people picking up their lives again and get their place in society back again.
Like your clients, when they come to you, do you completely take them out of society, like provide accommodation for them while they're undergoing their therapy, while they're undergoing the integration process? Do you take them, or do they live their normal life and have a program where they come every morning, go in the evening?
We have sheltered homes. We support people in their own home and visit them a few hours in the week or even in a month. We have shelters for children, but we also back up families and try to support and treat them in their own social circle.
So how do you handle individual cases? Do you have like a time frame within which their program is supposed to begin and end?
Not for everybody. People with a learning disability, that's quite a long support system. But everybody who comes in within Pameijer gets a support plan if there is treatment necessary. And we evaluate that every few months.
Has there been any kind of remarkable story that you've experienced in the life of a client who came in with all hope lost, and then you watched the process with which his program went, and then eventually became somebody that's useful to society? Has there been any
Yes,
special...
we have a lot of clients who can tell that story. We see people coming in with an addiction and are after a few months able to take their own life in their own hands again. Yes, we see that.
I come from Nigeria, and we've seen, well, I've seen a lot of people with disability problems, but unfortunately what we see is the fact that they have to fend for themselves. Society rejects them. They have to fend for themselves, and most times you see them becoming destitute. They hang around roads. They beg for means to have their livelihood. No support, no help is coming, not from the government, not from any form of organization. But recently we have some NGOs who are actually working hard to take them off the street, but these NGOs are also lacking the necessary funding and expertise, medical expertise, to be able to help these people. That is what has actually motivated me to, because I've actually seen how Pameijer is run here, and I've seen that there are many clients who would have been in that kind of situation in Nigeria, but fortunately for them, we have a foundation like yours that is rehabilitating them, and they've become useful. And it is also what's mentioned in here that I understood also that some of our camera team today are actually your clients. So they've become useful, and they're even becoming useful to this program that we're doing right now. How will you, with your experience here and understanding what I've just explained from the Nigerian perspective and indeed the whole of Africa, how do you think such a project can work in Africa?
Well, Pameijer is an organization almost 19 years old.
90.
So it's a very old organization.
Yeah.
And it started with supporting people in their own social circle. So that's a bit our history, and we have built up a lot of experience in doing that. So we have knowledge about how to do this, and of course we can share knowledge. We can share our treatment schemes, our support.
In the last 3 years, we've seen the Europe countries, even the Netherlands, face some form of a recession that has led to budget deficits, and governments are trying to cut costs. Mm-hmm. Has this trend affected Pameijer in terms of getting funding from government-related institutions?
No, we have had financial cuts, yes, but we try.
Has it affected your services? I mean, if there is financial cut, then maybe you want to reduce your staff strength, you want to cut on certain programs for the people.
Well, this year is the year for a change. We hope we don't have to fire employees, and we think it won't be necessary. When we can do our job a bit more efficient, I think we can carry the weight of the financial cut.
If a project like this should be recommended in Africa, mm-hmm. and Pameijer is approached, for instance, to stir up a pilot project like this, mm-hmm. To run in Nigeria as a country, what do you think will be the first step?
You need local people who know the surroundings in where you want to work. Be present in those surroundings. And then we can exchange knowledge. We can train people and explain on how we do it.
So you often run like workshop seminars and trainings.
For instance.
Do you do them only for your internal staff, or do you do an open training where people are free to apply from outside, people who have the kind of goals that you have?
Most of the time it's for our own employees, but we have had situations and projects where we trained people from other countries. We have had trainees from Poland, we have trainees from Romania, we have had trainees from the Ukraine. So we sometimes we have those programs to share our knowledge.
Do you sometimes face pressure from the insurance companies who are saying, well, you have to cut certain of your program because they want to pay less to cover the insurance policies of the people?
Yeah, that happens. The city council can say, well, we have a budget cut, you have to do the same for less. The insurance companies can say, well, this is the amount we provide, but you have to do this and this and this efforts.
This is a personal question. Are you working for Pameijer because you have a passion to help improve the condition of your clients, or you just took up this job because you wanted a job?
No, I work for Pameijer because the goals and targets Pameijer has are very similar to my own. It's also a belief of how do you want society to look? How do you look at the people in society? And that's a part of my drive, yes.
If a model like this is developed in Africa, what do you think will be the benefit apart from rehabilitating the patient? Taking them in as clients and then taking them through a procedure that can make them better effective for the society.
Yes.
Apart from that, what do you think will be the added value to the society?
Employment is one. An issue is safety.
Yeah.
And society as a whole functions better, I think, when everybody who can has an active role in society.
This is correct. Looking at what we want to achieve with this program, where we want the countries in Africa to emulate this sort of wonderful job that is taking place here, that has actually given life to people who society would have thought their life was over.
Mm-hmm.
What would be your last message? I mean, strong message to the people of Africa, knowing from what I've just told you that this sort of institution is lacking in those countries, and we have so many terrible cases of people who can be rehabilitated to become useful to our own society. What would be your message?
When I say it in Dutch, we have a slogan. Ertoe doen. Iedereen doet ertoe. Everybody is important.
Yes.
Every single individual is important. In his own way, but also for society.
After hearing the strategies of Pameijer, I wanted to meet some of the clients who have benefited from the program. So I sat down in an interview with 3 clients and their trainer. So why we're actually here, it's to speak to you guys, to know from you how you got into the Pameijer institution and what you've received in the form of training within the Pameijer institution. And then also tell us what has been your experience and what you are currently doing based on what you've benefited from the program.
Nou, ik heb 1,5 jaar een opleiding gedaan tot ervaringsdeskundige, een opleiding in het Hou je de Harp. En ik heb nu nog steeds geen betaalde baan, maar ik doe wel heel veel vrijwilligerswerk.
Ik zat eerst bij een andere zorginstelling en dat beviel me niet. En toen kwam ik in aanraking met een andere cliënt van Pameijer. En toen dacht ik van wauw, dit is veel beter voor mij. En toen ben ik Pameijer gegaan. Toen heb ik eerst de eerste jaar gewerkt aan mijn verslaving om daar vanaf te komen. Toen ben ik in 2011 in de zomer naar de cliëntenraad gekomen hier. En heb ik een half jaar gedaan. En dat vond ik helemaal geweldig. En toen kwam ook de opleiding van Hou je Harp, waar is mee bezig om dat te gaan promoten. En toen heb ik me daar ook voor ingeschreven. En toen ben ik in januari 2012 de opleiding gaan doen, Hou je de Harp. Ik ben nu vanaf 1 januari 2014 gewoon medewerker ervaringsdeskundige bij Pameijer.
Ik was toen ik begon zeg maar heel onzeker en negatief over mezelf. Ik kon mijn beperking niet goed accepteren. En nu ben ik veel sterker, ik verwoord me beter. Ja, ik sta voor wie ik ben nu. En ik geef cursussen, ik doe heel veel dingen binnen Pameijer. Ik ben gewoon een stuk sterker geworden dan toen.
Ja, ook weer gewoon aan het werk te kunnen gaan en weer bij horen. En elke dag gewoon opstaan en naar je werk gaan. Dat was ook wel vooral in het begin. 7 jaar eigenlijk uit kunnen slapen en doen wat ik wilde.
Ja,
en nu moet je ineens 's morgens 7 uur je bed uit en naar je werk.
Ja, dat is wel even wat anders.
Ja. Dat was best wel moeite mee die eerste paar maanden van de opleiding. Ja, en dan, je maakt iedere keer een stap, dus je groeit in je kracht van wauw, ik heb het gehaald en dan weer de volgende stap. Dus dat motiveert je enorm. Maar
wat je heel graag zou willen, je wensen daarover hebben met mensen waar je je veilig bij voelt. En ja, als allereerst beginnen te geloven in jezelf. En als je al het idee hebt van hé, ik wil een bepaalde verandering, dan in mijn ogen dan heb je al de eerste stap gemaakt.
Tenminste bij mij, ik dacht dat ik het allemaal niet aankon, maar ik had echt een coach nodig van joh, je kan het wel. Anders had ik het denk ik niet gedaan. Echt ook door de coach van joh, ik zie in jou dat jij het kan, dus erin geloven. En dan ga je zelf ook in je eigen geloven van ik kan het aan. Vooral als je de eerste stap hebt, succesvol hebt gedaan.
Ook een netwerk waar je op kan terugvallen, want dat is ook heel belangrijk. ja, dat je dan gewoon heel veel in beweging kan zetten. Maar
Ja.
gewoon beginnen. En alles is liefde.
Ja.
Can you tell us what were those things that you had that made you come into the program?
Nou, ik was wel... nadat ik heel veel negatieve ervaringen heb gehad met betaald werk en dat je daardoor niet gewerkt hebt, was ik wel toe aan het nieuws. En en ik wilde gewoon het zeker zijn van mezelf, me zelf laten zien, leren een verhaal te vertellen. Ja, en toen ben ik wel doordat ik bij die mobielsingle vrijwilligerswerk deed, en hun mij heel krachtig vond dat ik met mijn verhalen vertellen en zo.
Lenka, you said during the course of the discussion that you still don't have a paid job yet. I mean, a salary job, that you're doing more voluntary work. So how are you taking care of your housing, feeding and those sort of things?
Ja, ik heb nu nog een waaijong-uitkering. Dus zodoende heb ik, kan ik gewoon wel mijn huur en zo betalen.
And Pameijer is also trying to help you get a paid job.
Yes.
Okay.
Ja, ik heb ook zeg maar een wijnuitkering, maar die is nu iets minder, dus ik krijg een gedeelte van die wijnuitkering en een gedeelte betaalt Pameijer.
Ja, jij hebt wel eigenlijk een betaalbaan.
Ja, dat vind ik wel.
Tom, what was the specific program you enjoyed from Pameijer that changed all of that in you?
Hou je de harp, dat was het programma van in jezelf geloven, believe in yourself.
What do you think would have been the situation with you specifically if you didn't get this training that gave you this sort of strength and confidence?
Ik denk wel dat ik iets aan me minder zou gebruiken met mijn verslaving. Ik denk wel dat ik nog iets zou gaan gebruiken. Maar ik denk niet dat ik aan een baan had gekomen.
Right now, I am quite happy that you took the time to sit down with us to answer these questions, and I believe that our viewers who are watching right now would have benefited one way or the other from your experience coming into Pameijer and what Pameijer has changed in you. What are the challenge you face? I mean, coming into their world, not knowing them from where they're coming from, and having to work with them and to get them to this level where they become very positive.
Nou, dat viel eigenlijk heel erg mee, omdat eigenlijk alle ervaringsdeskundigen die ik tegen ben gekomen en die ik geholpen heb, zijn eigenlijk al zo empowered, die staan al zo in hun kracht. En een aantal ook van hen, die hebben ook al dingen doorlopen. Waardoor ik ook eigenlijk meer leer van hun dan dat ik soms aan te bieden heb.
And has this been, how did you find yourself in this direction? Was it your passion to help people like them, or you just doing it because you have to get a job for yourself where you can get an income to take care of your bills?
Nee, dit is inderdaad echt wel een baan waar ik op heb gesolliciteerd, omdat ik dit wel echt een enorm mooie uitdaging vond. Ik sta hier echt zo achter en als ik zie, ook voor mezelf, wat het verandert als je bij empowerment werkt en mensen coacht. En niet alleen voor mensen die echt ervaringsdeskundigen zijn, ook mensen zonder ervaring kunnen krachtiger staan door dit te bereiken. Ja. Probeer altijd positief te zijn. Maar wat ook heel belangrijk is houd ook ruimte af en toe. Dat je soms ook best wel eventjes niet positief kan zijn. Dat je soms ook wel even een dipje mag hebben. Het hoeft niet allemaal goed te zijn. Geef jezelf ook de ruimte daarin. Maar probeer daarna wel altijd weer op te staan. En dat is altijd wel dat vind ik mooi. Dat heb ik vaak gezien en dat is een mooie weegschaal.
Ja.
So finally, once again, we're happy to have you here and to share your experience with us and to tell us the transformation process that has brought you where you are today. Lenka, Jos, Tom, I wish you all the best, and I hope that you will continue to make to touch society positively and become role model to society. That no matter how much tough your challenge is, whether physical, psychological, if you endure, and there are programs out there like Pameijer that can help you redevelop yourself, build yourself, and become useful people to the society. Once again, I salute your strength, your courage, and the fact that you've been able to come through tough times and to be who you are today, to sit down looking gorgeously before our viewers. And I hope that those who are watching us right now will also use you as a role model to strengthen themselves, knowing that whatever the challenge they also face, if they can endure like you did and go through programs like this in whichever countries they're watching from, if they have it, they can become a better people to society. And Babette, I would not end this program without also thanking you for having the passion and the drive to endure and go through the same process that they've gone through as a coach, and to remodel them to become these wonderful people that they've become. So without people like you, Pameijer cannot exist as an institution. And I want to really appreciate Pameijer as an institution, because I've had the time to work within the work structure of Pameijer and see their program personally myself, because I've come to meet wonderful people. And part of the creativity is also what we're enjoying today filming, because we also have one of the clients who also went through the same process you have gone through to become a talented film production team, filming us right now for people to see out there. So I want to thank you, and I wish you all the best in all your individual endeavor, and God bless you. Thank you.
Thank you.
Yeah.
Thank you.
Yeah.
Applausje.
Yeah, that was good, right? We have seen from this episode how ordinary people who have been neglected by the society can be accepted by organizations such as Pameijer and given special training tailored to their needs. They have, in their own words, talked about how the program has given them confidence and improved health, that they can now function on their own. I want to use this medium to appeal to the government in Nigeria to empower organizations with such goals in the country to help our destitutes on the streets in Nigeria, to give them a better life. We can learn from Pameijer, and they can avail their experience in helping us achieve this goal in Nigeria. Once again, thank you for tuning in to this episode of African Europe Inside by the Sunny Ofehe Show, and see you next week, same day, same time on Ben Television. God bless you all for watching. Thank you. Bye-bye.